So what are your options if you decided to consider implant to restore your dentitions when you have no teeth? So in this presentations, I'll share with you what I usually use to help my patients decide on what is the best treatment options for their implant prosthesis, whether it is removable implant supported prosthesis or a fixed implant bridges.
So the first option you have, if you don't have any teeth and you already have an existing denture, or you are becoming completely dentureless, is regular denture supported by 2 implants. So this is basically, you think about it, is the entry level to the world of implants. This is placing 2 implants that will help with the retentions of your denture. Dentures are acrylic prostheses that you can take in and out, and when you lose teeth, there will be no retentions or resistance. Adding 2 implants minimum on each jaw will help retain the denture and help in its stability. Usually we go through the process digitally. Nowadays, we can either make the impression digitally or we make it through the conventional way and then we digitalize the process. Basically, what you're going to end up with is a complete denture on the upper and on the lower, supported by 2 implants that will help a little bit in the retention and the resistance. Now, if there is a lot of bone loss and you would like to maintain a removable denture prosthesis, then we recommend having 4 implants. Having 4 implants will add more retentions to your denture and gives you more stability. It's the same concept. You have the dentures already fabricated, and then we add 4 clips. Those 4 clips, when they're engaged, they will help in the retentions and the resistance. Sometimes we can modify the denture so it will have less of a roof of a mouth coverage, but we prefer if we can keep that just to add an extra retentions and resistance elements to your prosthesis. Now, if you would like to upgrade to a completely fixed, non-removable prosthesis, then we have a lot of options. The entry level for this segment will inquire placements of multiple implants and a metal bar with denture teeth on top. So patients comes in, needs to have his teeth removed. At one point we used to place more implants. Now 5, 6 is pretty good. And sometimes we can get away with 4 implants. The concept is that you're gonna have a metal bar and then have the denture teeth bonded to that metal bar. That's why we call it the hybrid prosthesis, where we'll take the denture teeth from the denture and then the metal bar from the fixed bridges, connect them together, and then you have your hybrid prosthesis. The hybrid prosthesis will be bolted to the implant, so you will end up having fixed bridge, non-removable, and the advantage of this that it is economical. The downside that the denture teeth and the acrylic tends to fracture and the teeth will wear down quickly because they're made out of acrylic, specifically if they are opposing natural teeth. So you expect that you have to make that process multiple times, where we can take the metal work and then we add some more teeth in the future. Keep that in mind when you're making the decision. Sometimes, there is new things about giving the patients all acrylic digital. We like to keep this option only as a transitional because the fully acrylic fixed bridge tends to crack, a lot of wear, and you end up replacing it multiple times. So we'll keep that prosthesis as a transitional. Let's say when you have all your teeth removed, we'll give you an immediate acrylic fixed temporary until you get your final prosthesis in. On the other end, if you want to have more personalized option, then we go for a porcelain fused to metal. This is the original design when we started placing implant bridges. You still need the same number of implants, but then the prosthesis that goes on top is a porcelain fused to high noble alloy. This style of design requires a lot of laboratory technique and knowledge and experience, and we usually keep these options for the most demanding and the most advanced cases. The same concept, same number of implants, and then you'll get your implant fixed bridges. It usually happens in one piece. The advantage of this one is that it is a lot of aesthetic, a lot of customization, but the problem with it is that if something happens to one, that you might have to replace the whole bridge, or we can take that away, debond the porcelain, and add another layer. And that can be done on the upper and the lower. To mitigate this problem, what we usually do is we place more implants, and then we break down the prosthesis into segments. So 1, 2, 3. This way, if something happens to one and we have to replace it, then we can go ahead and do that at ease without putting the patients in a lot of problems. And the newer versions of this style of bridge is a zirconia bridge. Is a bridge that it is made completely out of porcelain, and the porcelain of choice is zirconia because of its strength and its aesthetic quality. The zirconia bridge is completely milled from a prefabricated puck, and then we go ahead and we can personalize it by either adding a little porcelain on top of it or stain it. Because of the porosity of the zirconia, it's usually, you don't have a lot of porosity. When we condense it, it's become so hard that sometimes the material that we added on become debonded. And this is why there is a lot of movements to just go for a full zirconia aesthetic buildup in the anterior and keep the posterior zirconia as monolithic as we can possibly can. So we can take a patient and we will go ahead and convert them for removable prostheses to zirconia bridges. The advantage of it, the aesthetic is just unbelievable. Tissue loves zirconia and they will really react very well to it. On the other side, we're starting seeing some crack in the zirconia bridge, that it's done in one piece, whether it is thick or thin. Different type of zirconia behave differently. So what we are trying to do right now is, in very limited situations, we'll go for this full zirconia. And my favorite implant bridge is the metal bridge with zirconia on top as separate segments. And let me show you a case to explain and show it to you. We have a patients who walk in, they need to have all their teeth removed because they have advanced periodontal disease. We go through the process, CT scan, take the teeth out, put the implants in, and let the patients walk out with an immediate fix temporary. We wait 2 to 3 months, and then we'll start working on the final. The final will be a bar that will be connected to the implant, and then we'll go ahead and we'll make the zirconia bridges as multiple pieces, and it will be cemented to the metal framework, thus ensure taking advantage of the strength of the aesthetic and covering the possibility of, if something fracture, then we are replacing the small segments of the bridge and we don't have to do the rest of the bridge. Adding on top of it, because we are digitally designing these segments, so we'll have a digital library. If something happens, then we can reprint or remill the pieces without having to go through a long process of impressions and fabrication. So the clinical situations, the bar will be delivered, and then then on top of the metal, the zirconia bridges will be cemented, so you will hide the metal, and then we get the benefits of the strength, the aesthetic, and reliability and replaceability of these bridges if something happens. So you end up with great result, great aesthetic, and you get to appreciate the before and after and what we can do nowadays with this style of implant prosthesis. It is highly technical and require an advanced provider that will be able to get you this style of restoration, and that can work also in a different shape. Still go for a metal framework and then zirconia on top, but some situations we have to break the the zirconia into multiple pieces. In these situations, the patients will have full extractions of their upper and lower, and then go through the process. Implants go in immediately at the time of tooth removal, and then the patients will walk out of the office with a fixed temporary. We go through a healing phase, and then we go and have as you can see, the metal base and the zirconia on top are in much smaller segments, because these patients can fracture teeth pretty easily. And if something happens to one, then it's much smaller segments to be replaced. Get to appreciate the before and after, and how well these zirconia bridges work, and how well we'll be able to maintain them. And then we'll see 7 years, 8 years, 10 years follow up on them. So I hope this information will help you make the best decision. If you still have any concern or any questions, please don't hesitate to contact the office and ask for complimentary consultation.
If you're getting value out of this video, please like and subscribe so we can reach out to more people like you.